The risk of breast cancer with use of HRT is in fact overall quite small. Unfortunately, the lay public, many healthcare professionals have a heightened anxiety about risk because I think breast cancer is a common condition and people naturally are concerned about it. I think the one worry about HRT is also exacerbated by the fact that it always seems to attract adverse media attention, and often the benefits of HRT are completely overlooked as a consequence, so it doesn't really help people to get a good context for making decisions about using it. There is a difference in the risk associated with different types of HRT preparations. With unopposed estrogen, which is the type of estrogen that's prescribed to women who've had a hysterectomy and had their uterus removed, it appears that and has been estimated that risk is not increased with exposure for up to 5 years, or if it is increased by a very small amount. And we're talking about maybe 3 extra cases per 1,000 women between the ages of 50 to 59 who use it for example, a duration of 5 years. With combined HRT, which consists of estrogen and progestogen, which is prescribed to women who do have their uterus, the risk is considered to be increased with increasing duration of use. But again, that risk is very small. We're probably talking between maybe 6 to 9 extra cancers per 1,000 women in a 50 to 59-year-old age group who use it. And again, with anything, it's always putting the risks into context and weighing up against the benefits in terms of cardiovascular disease protection, bone protection, and the well-documented improvement in menopausal symptoms and improvement in quality of life. One of the things that's a problem when HRT is discussed in the context of breast cancer is that other lifestyle risk factors for breast cancer are not brought into the conversation to help women make a balanced decision. And 2 of the factors that are additionally responsible for or associated with the diagnosis of breast cancer are being overweight or obese and postmenopausal, or drinking alcohol. And when you actually compare the risks of these with HRT, it's very helpful to get everything into context, because actually the associated risk with HRT is actually less than that associated with being overweight and postmenopausal and drinking more than 2 units of alcohol per day. It's actually been estimated, looking at all the cancers that are all the breast cancers that are diagnosed in the UK, it's estimated that maybe 2% are attributable to exposure to HRT, whereas with overweight and increased alcohol intake, you're talking about perhaps sort of 8% of the breast cancers diagnosed being attributable to exposure to those risk factors. There is no evidence to suggest that there is a dosage effect with HRT, so there'd be absolutely no point changing a prescribed dose to minimise risk. It's always sensible, as with any medication, to use the appropriate dosage for the appropriate indication, but that's something that comes down to discussion between a woman and the healthcare professional who's looking after her menopause management. But absolutely, there's no indication to change doses or to take HRT every other day, which sometimes women do. It makes no impact whatsoever on their breast cancer risk. So if you make the decision, the informed decision to use it, follow the advice of your healthcare professional. In women who have gone through an early menopause, the current advice which still stands is that years of HRT exposure accounted from the average age of the menopause, which in women in the UK is 50 to 51. So, for example, if a woman started taking HRT at the age of 35 because of an early menopause, for whatever reason, you would count her years of HRT exposure from the age of 50. Starting HRT at an earlier age because of an earlier menopause does not appear to be associated with an increased risk. So people can be rest assured about that. Overall, with the evidence that we have, it suggests that the risk of breast cancer diagnosis is not increased with the use of topical vaginal estrogen.